Hello, my name is Jillian Azar, and today I'm going to be discussing Alzheimer's disease. So first, I would like to start with the history of the disease, where it first originated. So the first known case was in 1901 when a woman named Auguste Dieter was introduced to Dr. Alois Alzheimer. This woman's family brought her to Dr. Alzheimer having symptoms of memory loss, paranoia, and aggression. And at the time, Alzheimer's disease was not known or heard of. So this woman was thought to have just mental issues. So she was put into a mental institution when her family was no longer able to take care of her. She later died 5 years later. After she passed away, her brain was sent to Dr. Alzheimer for examination. In examining her brain, he found many abnormal clusters, and at the time, he did not know what caused these clusters or what the clusters were made of, and we now know that they were amyloid plaques and neurofibrillary tangles that were in her brain. So going to the cause of this disease, scientists have not been able to find like one definitive cause, but there are factors that go into contributing to the disease. So the first one is kind of obvious in its age. When most people think of Alzheimer's, they think of older age because this disease is more prevalent in patients that are like 60 and older. It can be an early onset disease, but that only factors into about 10% of all cases. So the next is going to be the genetic risk factors, and that just goes into, can this disease be passed down through genes by your parents? And the answer is yes, it could. If you have a certain allele called apolipoprotein E, that doesn't mean that yes, you are definitely going to have the disease later in life, but it could be, like I said, a contributing factor. So next is the health and lifestyle risks, and that goes on including like if you have any other diseases such as diabetes or heart disease. If you're not healthy already and you already have many problems and diseases, that could contribute to getting Alzheimer's later in life. Also, how much you take care of your mental and physical health. Obviously, keeping your brain working is going to keep it healthy for longer, and same with physical health. If you exercise more, your body's going to be healthier and therefore be able to fight off and prevent diseases better. All right, next is going to be the science behind Alzheimer's, and that's just going to be like what happens in the brain specifically to cause this disease. So there's 100 million nerve cells in the body that all work together to communicate and function. So when these nerve cells start to die off, that creates a problem in communication between systems. So a patient with Alzheimer's has something called beta amyloid and tau proteins that grow on and in between their nerve cells. So like in the picture, you can see the normal brain has just the neurons, which is those nerve cells. And then on the Alzheimer's brain, you can see the tangles that start to go in between the nerve cells. That's going to be the tau proteins that go in between the nerve cells and start to create those tangles. And then the amyloid plaques are going to be those clusters that Dr. Alzheimer's found, but he did not know that those were the beta amyloid proteins that caused those plaques. So when too many nerve cells die, it causes the body to not be able to function correctly, and the breakdown of those functions can cause permanent damage to the brain, which is what happens and which is why Alzheimer's currently has no cure, because the damage that happens to the brain is permanent. All right, next we're going to go into the symptoms of Alzheimer's, and there are so many. So I like to do it in like 3 kind of categories. So the first is going to be the cognitive symptoms, which is what helps you be able to process thoughts and be able to use those thoughts to live out your daily life. So symptoms, the cognitive would be difficulty processing thoughts, confusion, that's where the memory loss comes in. I put change in mood because it does affect like it makes you more aggressive. It could affect like your mood. Next is going to be the behavioral symptoms. This is just going to be losing like functions in the body, which is why many people with like late onset Alzheimer's are not able to take care of themselves at a certain point, because it destroys the function of the brain, which then destroys the function of the body. Next would be the psychological symptoms, which are depression, anxiety, and paranoia. Anyone that has a disease this severe that has such an impact on you and your family obviously is going to come with many psychological symptoms. Depression makes you anxious, and then obviously paranoia, just, not being able to have your brain function correctly can take a big toll. So now I'm going to go on to treatments for Alzheimer's. So like I said before, there's clearly no cure for this disease. There are many medications that are given to patients to help lessen their symptoms. So it could help lessen their symptoms for years, only for months. It just all depends on the severity of the case, but there are medications that help slow down like the memory loss and just help a patient live the best life for as long as possible. So it's different for early onset Alzheimer's and for late onset Alzheimer's. The only difference between those two is just what age you start to show those symptoms. So early onset could be as, young as 30, and then late onset, like I said, is going to be most of the cases, which is 60 and older. So for the early onset Alzheimer's, there's a drug called cholinesterase inhibitors, and this medication slows down the breakdown of acetylcholine, and acetylcholine is thought to help with memory and things like that. So as it's produced, those clusters break it down, but this medication would prevent those clusters from breaking it down. However, this is only a short time cure, because as Alzheimer's gets worse, your body is going to stop producing acetylcholine, so then the medication is really not doing anything because your body is already starting to slow down the production of that brain chemical. For late onset Alzheimer's, there's a medication called memetine, and this is to slow down the production of glutamate. Now, glutamate is also a brain chemical, and what happens is if too much of it is produced into the system, it starts to kill brain cells and nerve cells, and that would just speed up the process of Alzheimer's, and that is what we don't want. So this medication is going to slow down the production of glutamate and hopefully keep those nerve cells alive for as long as possible. So like I said, there are other medications that can be used to help reduce symptoms. Obviously, these are not the only two, but these are the most effective ones that we have for now. Okay. So next, the last part is going to be the research aspect, and I find this really, really interesting because Alzheimer's is one of the most researched diseases because it's almost kind of like a mystery. There's so much to be learned about it still. So I noticed that Mayo Clinic and of course many others have been testing many different drugs, and these are in clinical trials and are being tested because these are drugs that we want to slow down the progression of the disease. So the medications that I talked about on the last slide are just going to be ones that help symptoms, help make the quality of life for patients the best as possible, but these medications that are being researched right now are going to be the ones that could stop the progression of the disease and actually maybe be a cure. So one of the drugs that is being extensively researched are called monoclonal antibodies, and this one is thought to be able to prevent the tangles from being created and even erase some of the plaques that have already formed. So, and the last one that I looked at was in clinical trials are medications that are able to resist that tau protein that forms the tangles. And I know that there are even some vaccines, tau vaccines, that are being tested. So anything to be able to get that protein to stop forming those clusters would be the ideal. And then next is just going to be a list of all my resources that I used, and thank you so much.